Hiring an associate dentist is an amazing way to unlock more schedule freedom, free time with your family, and most of all, fewer hygiene checks for practice owners. We're going to be talking to the practice owner here in a minute who is looking to continue to expand his amazing group. I want to share with you, Dentist Job Connect is here to help. We can help you hire an associate or find an amazing associate job. Please reach out to us at dentistjobconnect.com or text hire to 215-798-9897. And if you're an associate dentist looking for your first, second, third, fourth, fifth job, we have open positions across the U.S. Please text job to 215-798-9897. I'm thrilled to be talking with Dr. Ryan Fulchi here. He is someone I got to meet at DSI. Before we jump into your interview with your associate position, Ryan, tell us, what has DSI meant to you? I'm a huge Mark Costas fan. DSN's a sponsor. You guys have been amazing supporters of Job Connect. We had the opportunity to be in the same group down there. Just if someone said, why should I join a DSI or DSN and pay attention to this? How's it helped you as a dentist and practice owner?
Yeah, I think I actually have a unique perspective on that because I came into DSI and we were already a pretty big office. I mean, we were already at 4 locations, top line revenue doing over 8 million. So like, I don't think that was a typical
Yeah.
size office that's coming into DSI. But I can say, what I've learned in the couple of years that I've been with DSI was I found a unique ecosystem, a group of offices that had offices that were similar in my size, which was hard for me to find in my
Yeah.
local area. And so I was able to really kind of gain knowledge on how bigger operations did things. And I was really able to hone in communication and culture in a multi-location practice, which can become very difficult as you begin to add
Oh, for
offices.
sure.
The worst thing you want is an office to be, and we literally have an office on an island, but you don't want an office to feel like they're on an island and they're not part of the bigger picture. And so we were really trying to tackle those hurdles, especially because I was still practicing, still clinical most of the week. So we've since implemented some systems and some things to improve culture that we weren't doing previously. And I really do feel like the overall synergy between offices that aren't in the same physical space is a whole lot better. And we're actually starting to experience the benefits of what I always reference as iron sharpens iron, like having really
Yeah.
high level front desk team that can call over to another office and say, "Hey, I'm running into this problem. What would you do?" Or like, "Hey, we are slammed today. Do you guys have an opening over there?" And my model all along has been to stay in a tight knit area so our offices could complement each other.
I love
And that
that. I
we
love
were
that mentality. And I also share, it was, from this, as we get into your story, Mark Costas had shared in the beginning of the, presentations that, I'll use an example. You got one dental practice, you got one dental practice problems. You got 5 practices, you got 5 practice problems. You got
yeah
15 practices. Out the and part to that is all of us share the same stresses. I use the example of Jim Gaffigan, one of my favorite comedians. He says, when you have your fourth baby, nobody congratulates you. Having a fourth baby is like drowning in the ocean and someone throws you a baby. And I think
yeah
that's a good joke with multi-practice owners, but we have the same stresses. Need a hygienist, somebody's moving on for this reason. You get to explore that in the DSI community, which I love. And I loved getting to meet you more in person there. So I just wanted you to share that with our community. Now, if we drill down, pun intended, as to what you need to succeed right now, you're looking for an
yeah
associate dentist. You're in Savannah, Georgia. This is your ad on Dentist Job Connect. People can go and check out your position. It's an awesome position to work with you and your team. And I want to kind of go through these, and they're going to be fundamental. It might be repeating or reinforcing, but where are you located, Ryan?
So all of our practices are in Chatham County, and most of them are within the city limits of Savannah, Georgia. We have no practices outside of 20 minutes from the center of Savannah, Georgia. So we do have a practice that's on one of the islands, and then we are looking to merge, or we're looking to acquire a practice that's just outside the city, in an area called Richmond Hill. And beyond that, we're also expanding our existing spaces. So we have kind of multiple opportunities that are opening up as we continue to expand. And I'll say that we're really looking for the right fit.
Love that.
We're
I
not
was at
looking
the
for just a person. Yeah.
I was at the DeSoto Hotel for Savannah and Grits recently. I went to a great Mexican place that we walked to. I really enjoyed being down there. I got to get the name
Yeah.
for it. I'm sure you know it. And one of the things, that's what I want to go to next. I'm kind of known for saying, is your associate position a car or a boat? A car is a need, a boat is a want. We've helped
Hmm.
solo GPs, like my friend Dr. Mitchell Rubenstein hire his first associate. To be honest, Ryan, it was a want. His wife wanted more time with him. He wanted to lecture more. And he's thrilled that he has a part-time associate dentist with his boat position. And he was authentic about why he wanted that. But the need positions where you're either
Hmm.
replacing a dentist who's leaving, whether the practice is expanding, just kind of reinforce, why is this a need position for you? There won't be a shortage of patients. You're growing. Tell our audience about that.
Yeah, I would probably say that this is for us. I mean, I would say need and want. Boat car is more of a spectrum for us, and we're
Yeah.
probably a little closer to the need side, because in order to really expand in this area, and I will say that Richmond Hill is a new move for us. It's in an area that is rapidly expanding. They've just brought in a Hyundai plant that they're planning to open in 2025. It's bringing in 8,000 jobs in that direction. And that's part of the reason that we like the idea of moving in that direction. So we feel very confident that this office is going to do really well. This office is already doing over $1 million with one practitioner. Our goal is to expand it and move it into our own space that will be a little bit larger. So this is a real opportunity
That's
for
awesome.
someone to really come and improve themselves, and by doing that, that's how we establish partners. If you can come in and really establish yourself, grow our footprint, and do it in an ethical, way with integrity and good, sound clinical judgment and execution, then that's how we grow. I mean, it's in our growth statement that we grow organically. I'm not just growing to grow. This is not a DSO play. This is we see opportunities. We make a move in a direction, and we want to try to give the people that come on board with us the tools
You
to capture that.
You made me think of another F. My whole thing is, why hire associate dentist? It unlocks these F's: schedule freedom, free time with your family, fewer
Mm-hmm.
hygiene checks, and fueling your growth, right? Associates fuel your
Yeah.
growth for the right reasons. Now let's just kind of talk to the associate dentist. They come to your group and they just want to know, hey, I got dental school debt. These young dentists, Ryan, I find them to be, they're very entitled. Some of them, they like such entitled people. They want to eat food and have shelter. Like what kind of entitled person
Selfish.
yeah. So talk to them about compensation and then the what. Like, they walk in the office, what do you expect them to do procedure wise? Both, what you need them to do, what are their opportunities to do, and then how will they be compensated?
Dude, your question asking is like next level, by the way. That's just so
Thanks.
smooth and silky. Like,
Thanks.
so yeah, no, I,
Thanks.
I think that's a really awesome point. So compensation wise, I mean, obviously it would depend on what someone's bringing to the table. If you come in and you're doing IV sedation, you're doing surgeries, you're doing implants, that's a different tier for me in our practice, and we can fuel that, because we do have a lot of patients that need those things. In fact, I think all on X cases are an area of growth for us. We do a handful here and there. We really haven't pushed it the way we should be doing it. And so I would love an opportunity to bring in somebody who is already doing that, because again, we've got multiple offices that could fuel that. But back to your point, like, you know, how would they be compensated? So we currently we would do a daily guarantee as a minimum. We have percentage of collections as the way that we
Yeah.
compensate. Again, that's a little bit. There's a little bit of a range there depending on experience and what
Would
you're
you
bringing
say
to
it's
the table.
reasonable? I do these for educational purposes too. This one's, is
Mm-hmm.
fantastic. Like, I was a dental student. I didn't really know how an associate made $150,000 a year. My dad was a dentist, but he was an owner. He didn't talk a ton about money. So I didn't really know, like, when I got out, how do you make $150,000 a year? How do you make 200? Is it reasonable for an associate dentist to earn between two and $300,000 a year? Collect
Yeah.
eight to $900,000 a year in your
Well,
practice.
well, I would say that, like, we really subscribe to the super GP model. And I'm not sitting here saying that every doctor who comes in our practice has to do surgery and every doctor that comes in our practice has to do IV sedation. I think that there's really kind of two paths. Either you're really into surgery or you're not. And there are a lot of avenues. There's sleep dentistry,
Yeah.
there's Invisalign, clear aligners. All I ask is that, like, we we have a model and it's not a selfish model of like we want to do all the specialty work. I've always had a philosophy that we needed to capture, somewhere between 70 and 90% of the procedures that walked in the door. I really believed that general dentists should be educated and they should be smart enough to be able to tackle problems for patients. So when patients come to you with problems, you should be able to address them. Now, I also think you should know your boundaries and when to punt. But like I think that punting scenario, if you're really pushing yourself and you're really educating yourself, should be a very small percentage of what walks in the door. And so like collaboratively, we want to be able to tackle most problems. So I say that like when I say growing, making $200,000-300,000 a year, there's a great avenue if you really embrace Invisalign. I mean, you could really push that, and that can be your thing, especially in a group setting where there are other doctors who don't really want to do that.
Yeah.
And and then there's this shared benefit. So I think finding your niche, like whether it's aesthetics and you're trying to do full mouth rehab, if it's clear aligners, if it's like I said, sleep
And
dentistry,
what
which we
what I'll
don't.
add is, I'm at my own practice here, my scrubs, and we have, not as big a group as you, but when you're in an environment where good dentistry is happening, where someone's doing IV sedation, through osmosis, you just learn to be a better dentist from treatment planning, and you get to kind
Yeah,
of see literally outside or inside the operatory, is this what I want to do more of? I mean, what you said was perfect. Some people are super into surgery, give me that
yeah,
scalpel, and then other people are super into aligners. I don't want to see a scalpel. And I think that the fact that you can offer both of those things to an associate dentist is really remarkable for new dentists to be able, or even, experienced dentists to be able to do. I wanted you
yeah,
to add for a second, when dentists taking the job as an associate, Ryan, you sound like you practice where you grew up. I practice where I grew up. Okay. So
yeah.
I know this town I'm sitting in right now. Okay. But people are now moving from across the country for awesome positions like this. They come to Georgia, they work with you, but it's 5 o'clock, it's 6 o'clock, it's the weekend. What fun things would you do in Georgia as their fun tour guide? Give me 3 things you would do in
Oh
Savannah.
man.
If someone doesn't know, say, I would do this on the weekend. Here's what you could do, from museums to wineries to outdoor activities. Tell us about that.
I think Savannah it's obviously home, so I'm really partial to it. So, but
Sure.
I mean, I'll wrap off. Savannah has been home to a lot of movies, so it's been featured in like Forrest Gump, and people know
Yeah.
those types of things. But actually, the SpongeBob movie, ironically enough, was filmed in Savannah, and
Wow.
my old partner's car was in it.
Wow, that's cool. I
so
like
um,
that.
so yeah, I mean, SCAD has a huge presence here, Savannah College of Art and Design. So they have some really amazing like film festivals, music festivals that happen in downtown Savannah. Downtown Savannah is known for its historic district and the restaurant scene in the historic area. It's a mid-sized city, so it's not like the chaos of an Atlanta or a New York in terms of traffic and things like that. But yet we do have an international airport. So there's those things that I love about Savannah. Not to mention, most importantly, it's coastal. I mean,
Yeah.
we're real close to the beach. Boating is a big thing here. Fishing. There's a lot of hunting land when you go west in more inland. So depending on what it is that you enjoy, golf. We have a Corn Ferry tournament that comes through Savannah.
Oh, cool.
Multiple golfing communities, and it's just a great place to live. I mean,
Sounds like
I'm
there's
so proud.
something for everyone there. And I mean, I say
Yeah, I
this with
mean,
authenticity. I get it. Like, look at the two of us. Like, I live in Philadelphia, 40 minutes from my practice. I grew up here. I didn't move to the middle of the country for an associate job, and I get how hard that could be. But it doesn't mean not to do it. It just means to research where you're moving to, and you want to have
yeah,
what I say outside the operatory opportunities for fun. And you guys deliver that. I saw that when I went there. I want to go back to Savannah with my family, actually, because
Paul. And
it's
dude, I forgot to mention the most important thing. We have the Savannah bananas, and no one
oh,
else has
yes, yes, yeah, they're great. That is true. Well,
that.
that's a great place to end. I want to tell people that.
and
Oh, go ahead.
and our group has season tickets, so
I love that. That
yeah,
people should check out that podcast. I love marketing. I love branding. So text
yeah.
Savannah to 215-798-9897 to apply to this position. You can also go to Dentist Job Connect to check it out. You're an awesome guy, Ryan. I admire you. I learned a lot.
Thanks.
Glad we're becoming friends. Thanks for being part of what we're doing.
Yeah, man, really appreciate you. Thank you.